Good afternoon, Boomers. Brian Tong here from Boomer Life. I just got out of the hospital yesterday, and I thought it was time to post a little something about what I've been through for the last couple weeks. A couple weeks ago, I started having pain in my heel, which was diagnosed as plantar fasciitis. Not unusual. I got a cortisone injection, which is a steroid, and all was well for a couple of weeks. But here's the rest of the story. I'm 63-year-old male, and last year I started noticing that my periodic blood work that my testosterone level had dropped below the recommended level of 4 to 1100. Actually, it was down below 200. My doctor suggested that my hormone imbalance could be the reason why I was feeling sluggish and having trouble losing weight. So I began doing testosterone injections, 10 milligram injections right into the rear end once a week. It was a little painful, but I'm not afraid of needles, and it wasn't so bad. And they made me feel great. But sticking yourself once a week isn't all that fun. So I learned about testosterone pellets, which can be placed under the skin through a small incision, and this will give you 6 months or so of T-boost. I thought, great, let's do it. And I did back in June. My doctor also around that time told me that my hemoglobin showed that my blood was thickening and recommended that I donate blood, which I did. Back in March or April, I got the 2-dose Moderna vaccine for COVID, as many others have. I heard small rumblings about the possibility of blood clots as a side effect, but I thought nothing of it. And that was mostly in women, and I had no history of clots, heart defects, blood pressure problems, diabetes, or anything. My family prefers cancer as the morbidity of choice, so there you go. Well, after the cortisone shot, I started having pain in my shin for no apparent reason. My foot doctor said, don't worry about it. I got some massage in my leg to help with that, and strangely, the pain moved from my shin to my thigh. Then on Sunday, August 1st, I started experiencing shortness of breath and a slight fever. By the next morning, we were concerned that I might have COVID, so I went to the hospital. They tested me for COVID, and it was negative. They said, well, you have symptoms of asthma. They gave me an inhaler. Well, that didn't stop the symptoms of loss of breath or fever. So on Thursday, I went back to the hospital for another COVID test, which was also negative. This time they did a chest x-ray and an EKG, and both of these were negative. So they said, you've got a respiratory infection, and they gave me a Z-Pack. I was still having leg pain, by the way. So 7 days of antibiotics later, my symptoms were all getting worse. Clearly, I didn't have a respiratory infection. Then last Sunday on August 15th, my right thigh began to swell to the point where it was 4 inches bigger around than my left. I went to bed concerned. On Monday, it was not better, so I began researching single leg swelling and diagnosed either cellulitis or deep vein thrombosis. I called my doctor and said, I need an ultrasound. I think I have clots in my right leg. He set it up at 2:30 that afternoon, and they verified the clotting from my ankle to my groin. They immediately sent me to the big hospital for a lung CT scan with contrast and verified bilateral pulmonary embolisms, which is blood clots in my lungs, which was obviously the source of my breathing problems for the last 2 weeks. And they admitted me to the ICU, put me on a heparin drip. That was Monday. So now it's Friday. I survived 4 days in the hospital, surrounded by code blues and COVID patients, and have begun 6 months of treatment on Eliquis. We're not sure what caused the clotting, but we think the cocktail of testosterone therapy, vaccine, and steroid injections all may have played a part. So while we aren't sure what the cause was, and we're still going to look into it, my advice to you guys out there contemplating a little testosterone to invigorate the P muscle, beware of your hemoglobin and watch for clotting, especially if you've recently been vaccinated. And that's all for now, Boomers. Have a good day. Brian Tong, Boomer Life, out.